Thank you very much for this opportunity to highlight the important maintenance post-transplant trial that is examining the clinical activity of a combination of azacitidine and venetoclax in patients allografted for acute myeloid leukemia. Maintenance therapies are now an area of intense clinical interest as a strategy to improve outcomes in patients allografted for AML. And clearly there is now randomized data that post-transplant sorafenib maintenance is associated with improved survival. The question now turns as to whether we can develop suitable maintenance options for all patients transplanted for AML. So the VIALE-T study has already delivered the Phase I/II component. There's an MTD established, and it's now opening up in centres across Europe and globally as a randomised study with an endpoint of event-free survival. I think this is a very exciting initiative. And certainly my sense is that focusing on optimizing post-transplant interventions, whether that's a rapid taper of cyclosporin, potentially the judicious use of prophylactic donor lymphocyte infusion, or pharmacological interventions, is the most likely way that we're going to be improving outcomes in this high-risk patient population.